I'm Grace Whiting. I'm with the National Alliance for Caregiving.
Thank you, Grace. Can you tell us a bit about the mission and focus of the National Alliance for Caregiving?
The National Alliance for Caregiving is a nonprofit organization, and we're dedicated to supporting America's 44 million family caregivers. We do public policy research, advocacy in the U.S. and states, and international advocacy with a coalition of about 14 countries.
Great. We're so thrilled that you're here at BIO's Patient and Health Advocacy Summit. What's been your biggest takeaway this year from this event?
I think the biggest takeaway is the need for patient advocacy groups and companies to work together and to continue to engage in dialogue. It's so important to have that conversation when you're trying to support patients and their families.
And I know that you've been attending the BIO International Convention for several years, and you've been in the Patient Advocacy Pavilion, is that correct?
That's correct. So I've been in the Patient Advocacy Pavilion for 3 years and representing the National Alliance for Caregiving, and it's been an amazing experience to meet researchers from all over the world, innovative companies, and other patient advocacy groups that are trying to improve lives of real people and their families.
Have you had any partnerships evolve from this experience at the Pavilion?
So one of the best things about the Bio Pavilion is we've had 2 wonderful projects come out of just casual conversations at our individual patient booths. One was a study of cancer caregivers in the United States, and we actually partnered with the National Cancer Institute and the cancer support community to do a statistically representative look at people who are caring for somebody with cancer. And it was amazing that that just grew out of a conversation from the pavilion. The other is a study of people who are caring for either a child or an adult with rare diseases. So those communities are fractured. They've got a lot of advocacy power, but they haven't talked about the impact of rare disease in the aggregate. So we had a conversation with Global Genes. I showed them one of our reports, and out of that we've developed this great study, and we've now got over 10 companies partnering with us, and looking forward to continuing that work.
That's great, and it all came from just hanging out at the Advocacy Pavilion at the convention.
That's it. The Advocacy Pavilion at the convention got us a chance to really meet people face to face and connect in a way that sometimes email and phone just doesn't allow. So just meeting real people and doing awesome work together in person is just an invaluable experience for us.
That's great. Thank you very much, Grace.
Yeah, thank you.